Many people are familiar with signs of skin cancer, but what about a condition doctors call pre-cancer?
Our health specialist Denise Tador shows us what the earliest warning signs look like, plus the latest word on salt intake.
The word is keep it low. Despite calls to increase the salt allowance for healthy individuals, the American Heart Association is standing firm. After reviewing new evidence, experts conclude studies saying people can consume more salt is misleading. They're sticking to no more than 1,500 milligrams a day, which is less than a teaspoon. The key to living independently and preventing dementia appears to be affected by how much exercise you get. A report in the journal Stroke found seniors who showed signs of vascular dementia in their brains lowered their risk of the dementia getting worse if they stayed physically active. Study authors say seniors should try for 30 minutes of moderate exercise at least 3 times a week. Dermatologists tell us to be aware of moles that change shape and color, but there are other warning signs of skin cancer to look for, too. They can be difficult to detect, precancerous patches often mistaken for breakouts or rashes.
You've got a few little rough spots up here. Those are ones that we're going to need to take care of.
Getting rid of precancerous skin cells is something 84-year-old Morton Witz is quite used to.
Those were actinic keratoses. So those are caused by years of chronic low-grade sun exposure.
As a young man, Morton spent a lot of time at the ballpark.
I'm a devout Chicago Cub fan.
Dermatologist Dr. Lisa Chipp says, while many people know to look for odd-shaped or discolored moles, actinic keratosis, or AK, causes non-melanoma cancers such as squamous cell.
It's always there in the same spot. It doesn't get better with topical steroids like eczema will or with moisturizers. It doesn't go away.
You're more likely to get actinic keratosis if you have fair skin, you're out in the sun for long periods of time, and if you've had a lot of sunburns when you were a child.
If you leave them untreated, then they can evolve into squamous cell carcinomas.
They can spread to lymph nodes and other organs if you don't treat them. People with AK are most likely to acquire other forms of skin cancer as well.
The actinic keratosis is usually the first sign there's been enough skin damage and sun damage to get these non-melanoma skin cancers later in life.
Dr. Chips freezes them off with liquid nitrogen, but there are other ways to treat larger areas of skin.
We treat them with topical medications, from mild treatments like Renova or Retin A, and some of the DNA repair enzyme creams.
To prevent actinic keratosis?
Sunscreen, sunscreen, sunscreen.
Today, Morton always protects himself from the sun, but it took several brushes with skin cancer to convince him.
If you're going to be in the sun for any length of time, make sure that you either cover up or wear sunscreen.
And because it can be difficult to tell which spots are precancerous and which ones aren't, it's best to have a dermatologist take a look at any spot or lesion that changes color, grows, or bleeds. For more information, log on to abc7.com/healthyliving.